Okay, well, thank you everyone. Welcome to the APPG on cerebral palsy, and thank you for coming along today. And can I ask people to tweet today's using the hashtag APPG ONCP. And just to begin with, I'm going to set out a bit of the progress since the last meeting in September. So the APPG published its second report on best practice in education, health and care plans, teaching and learning for children with cerebral palsy, and that was on the 6th of October. The Secretariat has met with DHSC and NHS bodies to discuss the progress on implementing the report on early intervention that last month. And we have been promised an update on all of the 11 recommendations. And DHSC and the NHS bodies have also agreed to our suggestion of establishing a working group to ensure that the report is carried out. And our call for evidence for the third report is open until the 30th of November, and you'll be able to find more details of that on the website. So thanks again, everyone, for attending. And building on the work of our previous meeting, which examined barriers to accessing healthcare for those with cerebral palsy, this session will focus on the obstacles encountered in the workplace. Most important fact to emphasize about this session is that we're not content to confine our discussion to adults with cerebral palsy being able to work at all. In the wake of a period that put flexible working to new levels, accessibility to employment should now be given. So as the focus of this part of the APPG's work, examining cerebral palsy as a lifelong condition, is to explore what needs to change to allow adults with cerebral palsy to enter work and progress and thrive. A fulfilling and vibrant, satisfying career shouldn't be beyond anyone's reach, let alone those in our community. So in discussing work, we don't want to ignore the question and challenges posed by the pandemic, but instead try and use them to contextualize what's working well and what needs to change. The moment for implementing meaningful change across the complex sphere of employment is shrinking, especially for adults with cerebral palsy. So we're going to try and strike an optimistically realistic note as we set out on this topic. Optimistic because we've seen that change is possible, it's realistic, and because there are many challenges yet to overcome. But the lesson of the pandemic is that what we define as work simply cannot be seen just through the traditional 9 to 5 Monday to Friday dynamic. There are many opportunities out there, and as many as possible of those opportunities should be open to adults with cerebral palsy. So with that in mind, I'm delighted to welcome our distinguished panel of speakers, including Steve Timms MP, Chair of Work and Pensions Committee. Stephen is a former Cabinet Minister and brings with him ministerial experience from the Department of Work and Pensions, and he shadowed the employment brief for 5 years in opposition. He's a really important voice in the parliamentary debate that we have about access and chances in work. And we have Louise Rubin from Scope, who's an experienced campaigner and public affairs professional who's been with the organisation since November 2020. There's Susan Hourihan, who is an occupational therapist who works in London, and she's going to provide us with the vital perspective of clinical support, and she can help remind us that these issues cannot be seen in silos. Jacqueline Stevens is a cerebral palsy advocate, entrepreneur and disability champion who will be speaking to us about her lived experience of how cerebral palsy has affected her experiences in the workplace. And finally, Angela Matthews is head of policy and research for Business Disability Forum and works as an advisor to many businesses and organisations. So I want to thank all of them for being here today, and we look forward to hearing from you all. So without further ado, I'm going to hand over to Louise Rubin from SCORE. Over to you, Louise.
Thank you very much. Yes, so as you've heard, I am Louise Rubin. I'm Head of Policy and Campaigns at the disability equality charity Scope. And it's a pleasure to be here today talking with such a great panel of speakers. As you might know, Scope is a pan-disability charity now, but we were founded as a CP charity, and we've retained that interest in people living with CP and their families. And we support that community from childhood right throughout their lives. We have a programme lead who supports the CP community via an online hub, through our helpline and with direct contact. And we work collaboratively with other organisations and communities to keep that link going. We're really pleased to be co-sponsoring this event today and bringing the conversation to life. The discussion today is quite timely because issues around disability employment have been in the news again today, with the TUC reporting that disabled workers are paid on average 16.5% less than non-disabled workers, and non-disabled people are earning on average £3,500 more a year. We know that the disability employment gap for disabled people has been stubbornly stuck at around 30% for many years now, and young people in particular struggle to find employment when compared to young non-disabled people with the same qualifications. And we also know that at the peak of the pandemic, unemployment rates for disabled people were rising faster, much faster than they did for non-disabled people. At Scope, we heard every day from people whose employers had refused them furlough and had instead reduced their hours or simply made them redundant. And in fact, again today, our friends at Leonard Cheshire have published a report which shows that disabled people's finances were hit hardest by the pandemic, with around 40% saying that they faced financial hardship, such as increasing debt, having to rely on food banks and so on. And our own research here at Scope backs this up. So what does all of this mean for people with CP? Well, there are around 135,000 people living with cerebral palsy in the UK. But because there's no register, there's no specific employment data for that group, unfortunately. And what's more, it's a condition that affects each person differently. So the support that they might need to find, stay and progress in work will differ between people. But there are some things that the CP community consistently tell us. They tell us the condition fluctuates, largely due to pain and fatigue levels that can vary day to day, and managing a job with those day-to-day effects can be quite challenging and can take quite the toll on mental well-being. So moving on to what government is doing about this. Well, as we all know, the National Disability Strategy was published this summer, and for the most part, Scope welcomed the commitments aimed at supporting more disabled people to find and stay in work. Commitments such as reforming access to work, looking at mandatory reporting on disability figures for larger employers, and for improving the disability confidence scheme that enables employers to take on more disabled employees. But as ever, there's room to go further, and we feel that's what's missing is an urgent targeted support for disabled people this winter and as we recover from the pandemic to close that disability employment gap. The measures in the strategy are a move in the right direction, but much more can be done. We're particularly disappointed that government won't be reforming statutory sick pay anytime soon, despite starting the consultation on that system back in 2019. It's an inflexible system and the amount of money given to people is low. It's a major driver of disabled people falling out of work because they're forced to choose between their health and employment. People with cerebral palsy and other fluctuating conditions need to see greater flexibility in the sick pay system. For example, by removing the waiting days before sick pay kicks in and allowing for phased returns to work rather than an all or nothing system. Doing this would allow people to much better manage their disability while staying in work. The National Disability Strategy also outlines welcome changes to access to work. We know it's an effective scheme for people with CP and other people with disabilities. And the government's proposals to introduce passporting so that you can essentially take the adjustments you've been given into a new role has got great potential to allow people to move between roles and to progress in work. But we also know that uptake of the scheme is far too low. It's simply not known about, and it's slow. People wait months for the adjustments that they could get through the scheme, but employers won't always wait. The APPG, as we've heard, wants to consider what we can learn from the pandemic as we look towards recovery. The pandemic has had many devastating impacts on disabled people that we're all familiar with, but it has demonstrated that there are other ways to do things, particularly when it comes to how we work. There's an opportunity to reshape the world of work, with working from home, of course, being the obvious change that most disabled people have welcomed. There is a huge amount of evidence, growing evidence, that it's helped people to manage their day better, to reduce fatigue, and of course, to retain control over their lives, which is particularly important for people with CP. I've spoken quite a lot about the opportunities and the challenges, but I also want to emphasise the scale of the prize on offer if government gets this right. There are 8.4 million working age disabled people in the UK. Halving the disability employment gap could boost UK output by around £50 billion a year, with an extra 17 billion in the government's coffers each year. For government, this should act as a huge motivation, but it's not the only thing that motivates us. Here at Scope, we want to close the gap in employment rates between disabled and non-disabled people, because every day disabled people tell us they want to work. It would improve their sense of purpose, their sense of belonging, and their well-being, and that's what it's all about.
Thank you for that. Thanks, Louise. Some really quite stark statistics there. I think, you know, although the report is welcome, and it's great that there are those measures that you're pushing for, I think just the fact that a disabled person is paid 16.5% less than a non-disabled person is absolutely shocking. And that needs to change, and that would make a huge difference to somebody's life. I'll move straight on now to the next speaker, who is Susan Hourihan, the occupational therapist. So over to you, Susan.
Did you want to share my slides? Yeah, great. Thank you, Mike. Yes, so it's a pleasure to be here today to talk to you about employment and health for people with CP. Could you move to the next slide, please? So when we talk about health within healthcare, we refer to the World Health Organization's model, the International Classification of Functioning. And when you look at this model, actually what's really nice about it is it draws not just on the medical model, but also on social model participation and so forth. And in particular, what we're looking at is not just the body, not just the disease itself, cerebral palsy, not just the body functions, the effect of the cerebral palsy on the body, and this will vary for each individual, but the things that we most commonly see in the adult population are spasticity and or dystonia, weakness, pain, problems with mood and mental health, cognition and fatigue. Now, the cognition is often due to the pain and fatigue and the impact on cognition. Sometimes it's a separate process. But these body structures, which is the traditional area of focus of health, impact on all of these other areas. So they impact on the person's ability to take part in activities such as walking and mobility, using computers, public transport, writing, washing, dressing, food preparation, hundreds more, but activities that are all required to either do work or be prepared to do work. And then not being able to do those activities really severely limits participation in work, also in self-care, leisure, and in the role of parenting. But in this context, we're focusing on work. And there are other factors that we need to think about within health. And I think one of these can be personal factors due to just specific to the individual and their background. And it can also be environmental factors. And this might be the physical environment, or it could be the social or legislative environment. And I think this is an area that I'd really like to see picked up on for adults with CP, is how do we change the environment in health to make sure that all adults with CP have access to really effective treatment and healthcare services. If we could move to the next slide, please. To address all of those areas, we need to look at individualized multidisciplinary team intervention, and this will cross all sorts of different sectors, both primary and secondary care. It'll cross into areas such as external agencies external to health, such as social services, the DWP, and charities, specifically looking at scope here. But we have a whole range of different services and individuals that need to be involved. So if we could move to the next slide, please. So when I was a part of the CP guidelines for adults, and one of the guidelines that we're really referring to today was looking at referring adults with CP who would like to work or who are already working to a professional with expertise in vocational skills and independent living. And the reason those two things were coordinated or brought together in this recommendation is that quite often people have the vocational skills for job, but actually, or for work, but actually are finding it difficult to get to work, to get dressed, to be independent enough to get to work, or they're independent with those things, but they're fatigued, they're in pain, and that limits their participation in vocational activities. So all of these different areas would be things that we would expect for an adult with CP to be given information on. So if we could move to the next slide. I wanted to present to you a case study on a chap which I think exemplifies this process. John is a 27-year-old man who had a level of disability in cerebral palsy that's called the GMFCS. And what that really means is that it's really related to classifying children, but it extends into adulthood as well. This is somebody who can walk and can walk in most settings, but might need a rail to climb stairs, and actually over distance might have difficulty leading to need of either rest or an aid. So John's a young man with fairly low level of disability, actually, and he came to our cerebral palsy clinic. Now I must stress this cerebral palsy clinic was started by Dr. Val Stevenson, who spoke in the first meeting, and this clinic was started on the back of the NICE guidelines. The NICE guidelines laid the foundation to support the business case for this clinic to be developed. It was not there before the NICE guidelines. So this chap came to us and he had dystonia affecting his speech, his hand function, he had pain, fatigue, and he had really significant confidence issues. These things were not static. He had not been a child and developed and become an adult and his healthcare needs had ended. Often CP is presented as a static condition, but what we know in healthcare is it's a deteriorating condition, and it deteriorates over time. He had had no healthcare since he left childhood services, and certainly in our adult service we see this all the time. It's terrible how often people fall out of healthcare once they become an adult. This was a very clever young man. He had 3 A-levels. He had a first-class degree in accounting and a master's in accounting with merit, and he had a really supportive family. What the difficulties were for him was that his communication impacted on his confidence to attend interviews. He had poor hand function, pain and fatigue, which affected his speed of efficiency in computer use, but also just in coordinating all of his activities of daily living throughout the day and incorporating travel and work into those. He had been unemployed with no employment history for 2 years since graduating, even though he'd been involved in a job centre program 3 times. He'd gone through that program with no interviews offered and no work experience gained. So if we could move to the next slide. So he had quite a lot of healthcare intervention. He saw the doctors and nurses for medication reviews to look at reducing the impact of dystonia and pain. He saw our physiotherapists and they looked at improving his activity tolerance and symmetry of movement and reducing pain. He saw our psychologists and looked at assessing and supporting his low mood. And from an occupational therapy perspective, we looked at reviewing his computer use and hand function. We fabricated a splint for his hands so he could use a computer. We fabricated resting splints for pain management, and we looked at a fatigue management group, which we ran for people with CP, and importantly, vocational rehab. So if we move on, our service has a vocational rehab service, and in particular what they looked at was, we discussed looking at volunteering given he had no work experience, and we linked him to Scope and their work program. We discussed the impact of his confidence on his work seeking, and we looked at motivational interviewing techniques, setting goals, where he referred himself to Access to Work to look at taxi support to get himself to and from work, so he arrived in a non-fatigued manner. We looked at him looking at voluntary roles on the doit.org website, and we looked at joining feedback into the next session on what he'd applied for, what was he interested in, what had happened, what was the feedback from what he'd done, and if there was no application for work, why was that, work or volunteering? And we looked at fatigue management in the work setting. When we saw him again, we reviewed and adjusted his goals and sent him back out again. And on the follow-up session, he had a job. And this was really incredible to me, that we could get all of this done with just this one session when he'd been through so many programs. But when we asked him what was different, he said, we looked at everything in its entirety. It wasn't just one thing. We looked at his health and how that impacted his work. We set up a plan for him to work with his employer, where he sits down and talks to his employer every 6 months to set out if there are any concerns that either of them have in relation to his disability, which removes the stigma of having to talk about his disability for both the employer and the individual. And we also looked at something that looked at the difference between disability leave and sickness leave. So we were able to look at if he needed additional leave because of his disability that was not to do with his sickness, they could be counted in a separate option. So if we could look to the next slide, please. So the key points I really wanted to press were that cerebral palsy is a degenerative condition. It has ongoing needs of health, and in particular in these 4 areas for our adult population. Healthcare in itself leads to a holistic assessment of needs across body structures, activity and performance, and then this leads to participation in society. And the adult CP guidelines in 2019 support healthcare involvement with people to keep them in, to help them get work, keep them in work and return them into work. But the one key thing that's really missing is that not every adult in this country has access to a clinic like our cerebral palsy clinic where all of this can be addressed. And that's still very much lacking within our country, unfortunately. Thank you.
Thank you for that. Very, very interesting. Always good to use case studies, isn't it? You can get a clearer picture, and it becomes a little bit more real. Our next speaker is Jacqueline Stevens. Jacqueline's the advocate, entrepreneur and disability champion. So over to you, Jacqueline.
Hi everyone, and thank you so much for allowing me to speak my truth on this forum. I'm an adult with CP, and in my experience it's not impossible, but it's definitely difficult to progress in your career when you have, you know, other factors that are challenging every step of your life. For me, there's kind of 2 really sort of big things with CP, and for me, it's the fatigue and the pain, and also the unpredictability of CP. For me, that's an absolutely constant worry, where you just have no idea on a day-to-day basis on how you're actually going to feel, and to navigate that with pressures of work and wanting to perform, it definitely brings me a lot of anxiety on a day-to-day basis. I think if we had good medical support and had confidence in the knowledge, knowing that we could take time out or we could take leave from work without being penalised, maybe having something like disability leave, I'm definitely sure that it would definitely give me a lot more confidence, and it would definitely ease a lot of the stress that comes and anxiety that comes with CP. But it also will fill me with a lot of confidence that there is something I can actually rely on if I'm having a bad day or things get too difficult. I mean, at the moment, I work full time. I've been in this role for about 6 months, and I disclosed to my employer that yes, I have CP, and granted, fair play to my employer. She did, take me into a room and say, how can we support you? But it was definitely an awkward sort of conversation. I don't think she knew how to actually lead the conversation. And in my experience, disability is quite a difficult, well, it's a taboo subject, because I don't think people want to offend. So they really, really don't know how to actually broach it. I mean, what I try and do is talk about CP every day. I mention it in a conversation, especially with the team that I'm in. And, my managers said to me, look, you have made it a little easier for me to sort of mention the word disability or mention the word CP. And that's what it's all about. It's getting employers and employees comfortable talking about it. So there is no awkwardness and there is no sort of taboo. I feel that, and it's no fault of the employers, but I do feel that they definitely need a lot more training or information on CP, and there needs to be definitely a process in place so they feel a lot more comfortable, so that when somebody's coming in with CP, they have confidence in the knowledge that there is process in place for them to be able to be successful, because that is what it's all about. We want to be on a level playing field and have the opportunities there to make us as successful as we want to be.
Thanks for that, Jacqueline. I think that's been really useful, and just reading through your own personal story, it's very, very inspiring of what you've finally been able to achieve. So thanks for that. I'm going to move on to next to Stephen. Okay, Stephen Timms. So straight over to you, Stephen.
Thank you, Mary, very much, and thanks for inviting me to the meeting. Louise mentioned the disability employment gap, the gap between the employment rate of disabled people and of the working population as a whole. And that gap has been an enduring feature of the UK labour market. It does look as though it's a bigger gap in Britain than it is elsewhere in Europe. So the Working Pensions Select Committee carried out an inquiry on this gap earlier on this year. We published a report on it in July, and the report is on the committee's website. And that gap was 40 percentage points in 1997. The then government introduced the New Deal for disabled people initially as a pilot, because nobody had really tried to tackle this before, and the gap fell steadily. It was 30 percentage points by 2010, so still a big number. Then it didn't budge for some years, but there is some evidence that over the last 3 or 4 years, it has, at least up until the pandemic, it has fallen a bit further. In the 2015 general election campaign, David Cameron pledged to halve the disability employment gap by 2020. That was a bold and ambitious pledge, but unfortunately it was dropped after the general election, and it was replaced by a target just to increase the number of disabled people in work by 1 million by 2027. And it does look as though we're probably on track to achieve that target. But looking at the statistics around the gap, one thing which does seem to be happening is that more people who are in work are declaring themselves to be disabled. So that has the effect of increasing the number of disabled people recorded as being in work. The gap therefore gets a bit smaller, but of course nothing has really changed because those people were in work all along, and that is a bit of a complication in looking at this to bear in mind. But our report published in July calls for reinstatement of the halving the disability employment gap target. We think that is feasible, and it's ambitious, but I think it's feasible, and also increasing the 2027 target up to 1.2 million more disabled people into work. The inquiry heard that the mental health disability gap, which is 35 percentage points, is a good deal larger than the physical health gap, which is 25. And there's a graph in our report that shows the smallest gap at 15 points for people with severe disfigurements, skin condition and allergies, and the biggest gap, which is for people with severe or specific learning difficulties, is over 60 points. So having one figure for the gap is perhaps a bit misleading. It varies by region as well. And I think Louise made the point that we really don't know what the gap is for CP, or certainly I haven't heard a figure. But one of the calls our report makes is for DWP's employment support for disabled people to be radically reorganised. It's right that there should be specific targeted support, employment support for people who are out of work on health grounds. Most recently, we've had the work and health programme, although that's a fairly small programme. But the point we made is that to be effective, support needs to bring together in each local area job centres, local support organisations, the NHS and colleges, in the way that Susan was talking about a few minutes ago. And we don't think that is best organised from Whitehall. So we call for funding for the work and health programme and successor programmes to be devolved so that groups of local councils, probably corresponding to the recently defined NHS integrated care system boundaries, that they are responsible for commissioning and delivering employment support for disabled people in their area. And we think the role of DWP should be in allocating the funding to the different areas, monitoring performance, and also publishing detailed comparative performance data so we can see how the different areas are doing and how what they're achieving compares with other areas. The report we published in July raises a number of other issues. Access to work has been mentioned, that's crucial. It does at the moment have a bureaucratic, time-consuming application process which leaves lots of people in limbo while they wait to find out what support they will eventually receive. As Louise said, the strategy published in the summer refers to change underway. We're promised a digital transformation of access to work. That does, I think, have potential for major improvement, or it could turn into a sort of computer says no kind of nightmare. I think it's really important that the department gets that right. We've seen with universal credit some of the problems that can happen when computer systems aren't as helpful as they should be. We do need, I think, to follow progress on that with a lot of care. We came across in our inquiry a good deal of skepticism about whether the disability confidence scheme, which employers get accredited into, whether that's really helping very much. We think it certainly needs to be urgently evaluated. It does look as though the disability employment gap has got a bit worse during the pandemic. That, as was mentioned earlier, that unemployment rose faster amongst disabled people than is the case in the working population as a whole. In the government's plan for jobs, we think there should be real-time monitoring of how disabled people are being supported in the Kickstart and the Restart programs, exactly as there was in the work program, which was put in place from 2010. At the moment, the DWP is just saying they will do an evaluation after Kickstart and Restart are finished to find out how disabled people got on, well, it seems to us that's really not good enough. We need to know, as the programs are running, how disabled people are being supported by them. So Mary, I just encourage everyone to have a look at our report. I'd be interested in any responses that anyone wants to make to it. I am hoping that the government's response to that report is going to be published next week, so we'll see then where we've got to. Thank you.
Thank you. Thanks, Stephen. Yeah, very interesting, and that's great that the report does have those recommendations in. So if people could have a look through that, especially in parliamentarians on the call as well, and let's try to get government to move on this. Thanks so much for your time. The last speaker we have is Angela, and after Angela there is time for questions. So if you have any questions you want to think about now, then I take those after Angela. So Angela Matthews, Head of Policy and Research at Business Disability Forum. Over to you, Angela.
Hi, and thank you everyone for having me. It's a privilege to speak to you all today. So the barriers facing people with CP have been, particularly during the pandemic, have been monumental, but I have to say just a magnification of the systemic barriers that already existed for them, particularly when searching for a job, when in work, and when accessing health and retail services as well. But I'm going to focus on getting a job and being in work today. So I'm going to tell you a little bit about what I've been hearing in my capacity as Policy and Research Lead at BDF, where I also work closely with our advice service who handle cases. So these cases I'm going to tell you about relate to people with CP's experiences when getting and staying in work, and the complex attitudes and perceptions from others that they often have to deal with as well. So first of all, looking for a job. The difficulties we hear about most from people is actually when people are looking for a job and looking through the job advert and the job description, understanding what the physical elements are. For a lot of people writing job descriptions, unless they have a disability of some kind themselves, what we see is very little explanation of what some sort of sector-specific jargon can actually be. So, for example, I heard from a bright, experienced individual who was applying for a job in a law firm. The job description said that a key element of a role was, quote, bundling. So what this referred to is putting papers, lots of papers together to help prepare a case for court. So this individual had lots of questions about bundling. You know, what is that? How is that done? Do I have to do it with my hands? Like, does a machine do that? Like, what does that mean? Because if I have to do this with my hands and I have to tie, you know, I'm literally tying up paper with my hands, this job isn't going to be for me. But if I literally have to put a stack of papers into a machine that bundles for me, then I can do that. So people often with CP often tell us that they look through a job description and what they're thinking is, they're thinking about the dexterity part of the role, and they're also thinking about the environment in which that takes place as well. So people said, I need to think about, will I have to do this manually? Do I need good dexterity for this? And what is the actual physical toll or the physical requirements behind each part of the essential elements of this job description? Interesting also that people with CP tell us in our advice team that the physical element, I'm doing air quotes there around physical element, to them also means how big is the built environment in which the job operates. So a lot of people with CP tell us that since the expansion of open plan offices, just walking from one end of the office for another, we hear from some people with CP says, it takes me a long time, and due to pain and due to the way I walk, it also takes me a long time, and it can be painful, and there is a physical fatigue that comes with that as well. Lots of people also want to know from the job they are going to apply for, where is the desk? in proportion to the toilets, to the restaurant, and to the meeting rooms. For a lot of very big employers, it takes a bit of a journey to get between each of those places. But this is really important to people with CP and with other disabilities, actually, to know before they apply for a job. So we heard from a couple of people with CP who said, we don't want a work trial as such, but what it would be really helpful to do is go and see people doing the job. So for example, with the example of this law firm, could people who wanted to apply for that job go and see, you know, what does bundling look like? What will it look like in this office if I was to do this job? Another barrier that a lot of job descriptions, job adverts ask for, good communication. Well, what does that mean? It's often a requirement, like an essential requirement of a job, and written into the advert and the description, but it's rarely clear what that means. So I heard from someone recently who said, I have CP and I sound like Stephen Hawking. Would someone employ me? If that person had the access to the right effective technologies that work in a remote way, then they said that would be no problem. But what do people who are going to be on that interview actually think? Because at the stage of the interview, I'm not going to have the tech I need. I need to get the job and then get the tech. So the sort of how access to work works is actually doing me a disservice, because I need to get the tech to show them I can do the job, but I need the job to get the tech. While we're on the subject of technologies, for a lot of desk-based roles, of course, particularly in the last sort of, 18 months, couple of years now, the technology is just more a part of our life than it ever was before. So what we hear from people with CP, also, it would be good to know when I'm applying for a job, what technologies are used. This came from people with CP whose speech is affected. So lots of people said, you know, it would be good to know, am I going to be using Zoom every day, or Teams, or Google Hangouts? You know, that's going to make a difference to if I can do this job or not. But job descriptions and job adverts haven't kept up with how we're working now, and tech and platforms we use are rarely mentioned when jobs are written and designed. We have heard to that end, we've heard from a couple of people with CP who have done an interview, they've got a job, turned up day one to do the job, and they can't use the internal tech systems and have gone home again. And that's really sad. A common ask from people that we're also seeing, even during the pandemic, because you know, not every job can be done remotely, is requesting a job closer to home. So we're seeing a trend where, for a lot of desk-based roles, people are saying, well, I can get a job that's actually based in Birmingham if I'm in Kent, because it's remote. We've heard from people with CP who have said, actually, you know, the job I do isn't desk-based. I want something closer to home, because transport is increasingly difficult. And we're hearing that where employers don't flex hours, people with CP then ask, okay, I want to reduce my hours then. We've just spoken about the disability pay gap. That, of course, has an impact on what disabled people with CP earn. So people are decreasing their hours when flexible working has been denied by the employer, just to avoid inaccessible transport or busy transport times. So in sort of 9 o'clock in the morning, between 4 and 6 in the evening. One person with CP told us that regardless of the hours, they are working in London, and she said, quote, I am slower to move around. And what she was actually referring to is simply coming out of the station and walking down the street in London, and people rushing by her when she walks quite slowly. And of course, she said, what comes with that is, you know, I can do it, I need time to do it, and it's going to cause me pain, and it's going to make me tired. So, you know, that's what work does for me, even before I sit down to do my job. So Just to say a little bit about when in work, and for people with CP, particularly during the pandemic as well. So nearly all of the queries we got about employees with CP during the pandemic were around losing access to work, or around losing access to their PA or support worker. This was particularly because many people's support workers didn't have access to PPE some 5 months until after the lockdown. It meant that a lot of people with CP who contacted us couldn't work, not because they couldn't themselves, but because they had lost access to their support worker or PA. A lot of agencies were refusing to send support workers and PAs if there was no PPE, and access to work, which is a work saver for so many people, was quite slow to be updated and to say, okay, we'll fund PPE for support workers. It is one of the biggest work-related tragedies to happen to disabled people during the pandemic, when the government forgot to put access to work at the centre of its support. It really did affect so many people with disabilities, not just CP. So access to work did try to respond quickly, even though it didn't sort of get much attention. It had a huge lack of resource, and as I said, not much attention was given to the scheme during those early months. But a separate but related issue was that we heard cases of where access to work advisors were trying not to recommend human support such as PAs, because they knew that PAs were being turned down by agencies. So in one case, we had an individual with CP who had an operation and lost some of his mobility. It meant that after his operation, he could no longer use the toilet independently by himself. So he needed a PA. Access to Work recommended speech-to-text software, screen magnification, and a headset, and said that this person did not need a PA if he was to use those technologies. After pushback from the employer, Access to Work eventually signed off this person having a PA for 5 hours a week. How many of us here could say in advance when we will need to use the toilet next month? But in effect, that's what government policy asked this individual to do. And one last thing before I finish, the perceptions of that other people have of people with CP are huge and really damaging. So I had a case where a customer service advisor had asked a customer to leave the store because, quote, their speech was slurred and they could not walk straight. I had another case as well, where an individual was called into a manager's office. They had come into work on a different floor for that day, but had tripped over some boxes and couldn't get up unaided. His speech appeared, quote, off, and he, quote, could not walk well. In both situations, it was assumed that the individuals were drunk, and they were asked to leave the office and the store, respectively. Both individuals have CP. My closing comment: we see difference, i.e. someone who is different to us, and we make a call like each of the managers did in those situations. Attitudes and perceptions lead to behaviours, often behaviours that exclude. The call that these managers made here was you, the person with CP, are different, and therefore it's you who do not belong here. But it's not just people who tell people with CP that they do not belong. It's untrained access to work advisors. It's the technologies we procure without disability and accessibility specifications. And it's rushed and outdated job design methods that lead to poorly written job descriptions and adverts. So the single most important thing that we can do to stop creating more barriers for people with CP today is, in every decision each one of us in this virtual room are involved in, to challenge the hearing and speaking first approach to communications and doing work, and the technology solutions that we choose to implement, and our approach to organising built environments that assumes everyone moves and thinks in the same way. thank you for listening to me.
Oh, thank you, Angela. That was very thought-provoking, and I'm sure that raised a lot of questions with our audience. And you know, it's very stark that, you know, those simple tasks that we take for granted are actually a huge barrier to people with C, but actually are also the problems are quite simple to address, aren't they, as well, if people just put their mind to it. So I'm going to ask people if they could raise their hand if they have a question, please. And there'll be myself and other people on the call looking through the slides here. I'm just having a look. Anybody got their hand up? I'm flicking across the screen.
We've got some hands raised. We've got Claire Duffett is the first hand raised.
Oh, well done. Oh, yes, I can see. Hiya, Claire.
Yes, thank you. I was going to talk about, I was going to mention about occupational health, because I've had experiences where employers have refused to get occupational health involved when I know occupational health could help with the situation. ACAS's advice is that occupational health is recommended, but it's not obligatory. And that's what I think is something that should change, because I think a lot of employers don't understand the range of things that occupational health can help with. You know, it's not just equipment, but it's helping with hours, it's helping with, sorry, I've got CP myself, by the way, just to kind of clarify who I am. It's you know, helping with, yeah, lots of different things around like flexibility and managing your health. And there's a lot of, again, it comes back to employer knowledge, and I think, yeah, there's a reluctance. Oh, we don't feel that's an occupational health issue, so we're not going to refer to occupational health. And some companies don't have occupational health already built into their within the company, especially small businesses. So there's that. Yeah, I feel that if occupational health were always involved and you always had an occupational health assessment at the beginning, or any issues you had, occupational health were involved, I think we'd get better results. But also I do feel that what access to work, it was touched on earlier, what access to work offer is very restricted, because again, I've had experiences where there's some things that would be useful to me, but because of reasonable adjustment laws, the expectation is that the company will pay for it, not access to work deal with it. And if you work for a small business, very often they're very keen to support you, but they haven't got the finances to put the adjustments in place. For example, buttons for an accessible door. They can't afford it, they haven't got a budget for it, but access to work say, because the doors are used by everybody, not just the disabled person, we're not going to fund it, the company, so it's the company's responsibility to sort that out. So there's things like that which I really think could be improved.
Oh, thanks for that, Claire. Who would like to respond to that? And rather, Anna.
I'm happy to, Mary, if no one else wants to jump in. Angela speaking, sorry.
Yeah, sorry, go ahead, Angela.
Oh, is that okay? Hi, Claire, thank you very much for your comments. I'm thrilled you've had a really good experience with occupational health. A lot of...
No, I haven't, that's what I'm saying. The difficulty is getting access to occupational health, because the managers will turn around and go, no, this isn't an occupational health issue. We're not going to refer to occupational health. That's what I'm saying.
Forgive me, sorry. Yes, a lot of, it's interesting, with people with CP, I hear two different things. Firstly, some who can't get access to occupational health, and some who don't want to keep being pushed down occupational an occupational health route. So there's mixed views that I hear there. Claire is absolutely right on a few, on lots of different things there. Access to work for small businesses is huge. I'm dealing with a lot of small businesses at the moment who fall just into, they're like the smaller end of the medium-sized business. So in access to work policy, they have to pay a £500 upfront payment. They currently have, this organisation has someone with CP and 6 other people who currently need an access to work support. That's £500 per person, and they just cannot afford that. The other thing really important that Claire mentioned, buttons on doors. We hear this a lot, that access to work, actually a few, showing my age here, but a decade ago used to fund, used to provide funding for shared doors, but that's no longer the case. Some may argue that that's understandable because there are more offices now, there are more shared offices. Buttons on doors is actually so emotional because we also see that particularly small businesses are also using shared offices, not just an office in an office block, but shared offices. They might be using, renting desks in someone else's office. What that means is a lot of the time that the landlord or the person owning the office decides whether or not to make adjustments to the physical entrances of the office. And a lot of the time, a lot of the queries I receive are pushback on that. Occupational health for access to occupational health for small businesses. I don't know if the health is everyone's business will be a familiar policy paper to some, but it's looking at the role of, how do we get occupational health support to small businesses. The fit for work provision is no longer with us, but it is something that we're hearing from particularly our small businesses that, we just cannot afford even pay as you go occupational health support. So I don't have answers for you right now, Claire, but everything Claire is saying does need to be looked at and is really important. So thank you, Claire.
Thank you for confirming that my issues are quite common. Thank you.
Sorry, it doesn't.
Thanks, Angela, and I hope that was useful, Claire. I'm going to bring in next Baroness Stephanie Fraser has a question. Over to you, Stephanie.
Thank you, Mary, and thank you to everybody for a really fascinating session. I think that one of the things that has been highlighted by more than one of you is the lack of understanding of employers of, in our case, cerebral palsy. And I'm wondering, I know, Jacqueline, you were mentioning it, that employers want to do the right thing, but they didn't want to offend, they didn't know how to tackle this. Who do you think should provide the information on cerebral palsy? Where should employers go to, and where should we be directing them? Is it charities that should be providing this? Is it, where does the responsibility sit?
It needs to be a collective. It needs to be a collective. Obviously, the charities, obviously the people that have CP, we live it. So, we have the best information. We live it. But I think it needs to be a collective. I don't know if anyone disagrees with that, but anyone else has got any ideas?
I would come in on that. I support what Jacqueline's saying. I think it is a collective responsibility, but I do feel that when we arm people in health, when they start their jobs or go back into their jobs, we arm them with a tool, which is to sit down with an employer every 6 months to talk about their disability. And I think that strategy is really, really helpful because it gives both the employer and the employee an opportunity to formally talk about any concerns that they might have in relation to the disability that are separate to work performance. Sometimes they're affecting each other. But I do think that that is a really effective technique at bringing people together. I don't know how you would legislate for that conversation, but I do think it's a really important technique. And I know we worked with many years ago with the Business Disability Forum on a document that assists with that process. So there are resources available in the wider community.
If you don't mind me jumping in. Oh, go on, Stephen.
Sorry, Louise. I mean, one of the things we were told in our inquiry was that the government is planning an online information hub for employers, which struck us as an initial step in the right direction. We don't know how good it's going to be, but you know, I think the idea of the government providing the basic information that employers need is a good one and a welcome one.
Yeah, I was going to make much the same point. So I think there definitely is a role for individuals to talk to their employers about their individual needs. But of course, individuals are not all going to be experts on either the law or HR policies, or in fact, their condition. We can't expect individuals to have all of those answers. So we certainly support government's desire to build an employment hub. We know that employers find it really difficult to access information on disability. There's lots out there, but it's all over the place. We have stuff on our own website. Lots of our colleagues across the charity sector have things, and it can be difficult to find it. But one of the things that we seemingly unsuccessfully were calling for in the spending review last month was for government to be a bit more ambitious on this employment hub idea. We don't have a lot of details yet on what it will look, but we do have, how can I put it delicately, limited confidence in what it might look like. And we don't think it will necessarily be the dynamic thing that it could be and should be. Employers will need more than just sort of static information on various conditions. They'll also want probably to have a sort of portal that brings them into access to work and an understanding of what that can provide. So there's a lot of potential. At the moment, we are a little bit in the dark about what it will look like. But yeah, I think a one-stop shop or a hub or whatever we call it that all employers are aware of is critical.
Thanks for that. I hope that's been helpful. Next, I have Emma Livington from the Adult CP Hub. Emma.
Hi, thank you. And yes, it's been a brilliant session today, so thank you very much to all the speakers. I just wanted to change the conversation slightly. We've talked a lot about the barriers for people with disability, but I also think we need to think about employers and our role in understanding what qualities, what skills, what attributes people with this, having somebody with disability at your table in your workplace, what assets they are to the workplace. And I think we need to think more about the positivity of having diversity in the workplace and what people with disability bring to that conversation.
I mean, I absolutely agree with that, Emma, and it's something that comes up time and time again. We know that for lots of disabled people, they have a sort of tenaciousness and an ability to problem solve that comes with having to overcome so many barriers in your life. So there's an ability to be quite resourceful and think outside of the box and think of different ways things, which often does get overlooked. And it can be a real asset in the workplace to have somebody that does think differently to others. So yeah, I fully support that point.
And I think that goes alongside with something that was talked about in terms of job descriptions. If you always want what you've always got, then you're always going to get what you've always got if you keep putting out the same type of job descriptions. Not everybody is going to be good at everything. So we need to be thinking about what we need in our workplace and what somebody with a disability can bring, and what are their particular strengths, which can be an asset. But if we keep asking for the same things in job descriptions, then we're always setting people up to fail.
And just to follow that quickly, if I may, what Louise and Emma are saying is absolutely pivotal and also touches on the previous comment or question as well. In the situation I described, where someone who in the office, or where it was assumed they were drunk because they were moving differently, exactly what Emma's just said. There was a lack of diversity in that organisation, which made the manager think you're the different one. And so I guess response also to the previous question, whose job is it, who should be involved in sorting this out or changing or giving advice? I think the fundamental thing starts with every one of us, everywhere, in every organisation, which is, as Emma said, how do we increase diversity in our organisations? The people who asked that person with CP to leave the store and the other manager who asked the person with CP to leave the office, they were in effect creating a same groupthink environment. If, you know, so we've got to challenge, you know, what do we think about difference? What is difference to us? Who is different? Is someone else different, or are we all different? It's that fundamental understanding of difference and celebrating what difference brings, rather than thinking difference is a threat and I must not have it here. Excellent point, Angela. Yeah, certainly is. Next I have Leila Stedman, and could, if it's relevant, could the people asking questions say where they're from or which organisation they're with, if it's relevant. So Leila, are you there? Yeah.
Hello, my name is Leila Stedman. I'm 25 years old and I'm living with cerebral palsy. I really wanted to ask a question today because I have my lived experience of trying to work as a person with cerebral palsy is very relevant to all of these conversations. So for me, I think the first and only time I ever tried to have a full-time position was completely hampered and completely inhibited by my disability. I'm a well-educated person, if I do say so myself. I have GCSEs, I have A-levels, and I am incredibly passionate and driven to contribute somewhere. However, when I did attempt to embark on my first full-time position, the fact that it was a physical space that I needed to attend and needed to travel to was a problem. The fact that when I tried to approach my employer about reasonable adjustments, so many things that they could do for me were just optional and they didn't really want to, such as disability leave. They weren't aware that that was a real thing. And then when they were aware, they essentially just said, no, there's no laws that require them to do that or to pursue that. So really my question is to everybody who has spoken today, how does everybody feel about in this new drive by the government to review what they could be doing for disabled people? Should we also be thinking about making things like disability leave potentially mandatory for employers if they're approached by a disabled person within their workforce who says, look, this is not sick pay that I need, this is not sick leave, I have a disability and I will need, sometimes I will just ring you within an hour notice and tell you that my disability is bad today, because it is. Should employers really be able to get away from that? Or are some of the services that disabled people need, do they need to be mandatory for businesses?
Excellent question. Would anyone like to jump in and answer that?
I can always chat. So Louise, is that okay if I jump in? Hi Leila, thank you for your comments and your questions. I have a condition, not CP, but I have a genetic liver condition. I am the queen of hospital appointments. I need a lot of disability leave. I am fortunate that I work for a disability organisation and they get it. One of the key questions we get to our advice service is, and this is a quote as well, do I really have to grant disability leave? Interesting that it's seen as time off. It's seen as related to sickness. It's often seen as this person wants to work less and they are also disabled, which reinforces that sort of disabled people do less type thing. What disability leave really is an adjustment, and there is reasonable adjustment law, which says if it is reasonable for you to do so, do it. A lot of the time we are speaking to employers and they say, they do sometimes say, do we really have to do this? And our response is, tell us why you can't reasonably do it. If they don't have an answer to that, then, you know, it's probably going to be reasonable for you to do. The sad truth is that a lot of disabled people and people with CP do come up against employers that don't value you. You have spoken incredibly eloquently to us today. You're clearly talented and educated. And one of the key challenges disabled people have are finding employers who value them. A lot of the conversations I have with young people with my condition is about what you do when you come up against those attitudinal barriers from employers. Do I really have to do this? That's not an employer who values you. So I guess what I want to say to you today is I really hope you find an employer who doesn't see that as a problem, and someone who can value the skills that, you know, you've clearly shown to us today, because at the moment that sounds like an employer who is not valuing you.
I would like to say thank you for saying that you believe, just from what I've already said, that I would be of value. I believe that too, but I can say from experience that when you have to fight as hard as I did and self-abrogate as hard as I had to, only to not get anywhere, I actually resigned from my position after only 2 months. I couldn't cope with the pressure of needing to do that for myself. You don't feel like you're of value. You don't feel like you're relevant or important as an individual, let alone a disabled individual. So actually, I've decided since the pandemic that the pandemic has presented itself as an incredible opportunity for me that doesn't include me needing to physically attend a space and not needing to have these conversations, but also in the last few months I've been involved with Scope and I've been volunteering for them. And what I've found with potentially getting a job with them, doing interviews with them, is that they are a company who they understand disability from the inside, as you said about your own company. And I've got to be honest, as strange as it might sound, I now have no interest in approaching a company that doesn't have that kind of vested interest, because why would I? If I can approach a company like Scope, for example, and they already know before I even speak to them about my disability the sort of support I might need, then why would I go elsewhere? It's just saddening to me that there are people who are going elsewhere, have no choice but to go elsewhere, and they don't have those kind of attitudes.
Yeah, good on you. Yeah,
brilliant. That was great. Thanks for that, Leila. Very useful. And good luck whenever you do, whatever employment you do next. I've got 2 others on the list now. I want questions. I've got a Liesl and an S. Shaw is the name that's coming up there on the screen. So Liesl, sorry if I pronounced that wrong, but over to you.
Yes, hi. It is Liesl, and I'm attending today because I'm a person with lived experience. I have cerebral palsy, and I live and work with cerebral palsy, obviously. One of the things that I'm frustrated by, really, is I've worked around equality my whole career. And in 1994, I wrote my dissertation, my university dissertation, on mainstream opportunities in employment for disabled people. And if I were to read that today, all the points that I made back in 94, before we had the DDA, the Discrimination Act, we haven't moved along very much more. We've had a situation where employers have had the DDA enacted in 96, 25 years where we've had the requirement of employers to make reasonable adjustments. And we talk about it, and it's not just this forum, but others that I attend in the work that I do, where people talk about reasonable adjustments as though it's some kind of magic formula of difficulty. And it really isn't, because those precedents have been set for many, many years. Those examples are there. One of the things that I would like to talk about, and again, I'm disappointed because whenever I come to a conference or a forum about disability and we talk about the disability pay gap, what about leadership? It's not just about getting into jobs, it's about getting people into positions of leadership. And I really feel, having worked, like I say, I work around equality, so I work intersectionally. I think intersectional approaches are so important when we're talking about disability and other equality factors. But it's been alluded to, but we need to start saying what the barriers are. And actually what we're talking about is the manifestation of bias and the manifestation of ableism in the workplace. We need to understand how microaggressions occur, because they do occur, and we have to experience them, sadly. And also the emotional labour. In my case, I've had experience, I'm aging now a little bit, but when I was younger, I used to do a lot of able passing. And the emotional toll of able passing is just massive. And I don't think that these conversations are had enough that people understand, because disability is always framed in a medical framework. I come from disability from a social model understanding. So I have CP as my impairment, but my disability is the barriers I experience because of that. And I think there's just something about the best support and advice I ever got from early in my career. I was working with a lot of empowered disabled people and had some really good mentors. And the best solutions and support I've had comes from those solutions and from other disabled people. And I just feel there's something about mentoring that is really important in this, but also that understanding of what does ableism look like? How does it manifest? What are the microaggressions that disabled people experience? What about able passing? These things are never mentioned. We talk about making reasonable adjustments, but it's quite straightforward to make reasonable adjustments. The precedents are there, the examples are there. The A to Z exist already. I've written the Making Reasonable Adjustments guidance in the organisation I work in. We provide all of that and training, but it's just a frustration for me that we seem to be still quite a long way to go in just understanding the basics. And the reasonable adjustment really is a basic, because we've had to do it for 25 years, you know, legally. So that's my frustration. But I don't know if it's very much of a question, but I just felt, you know, we need to understand, we need to have the language to explore the real barriers that people are facing. People shouldn't have to work for disability organisations to have inclusion and belonging in their workplace. That should be, you know, someone earlier talked about diversity. So important that we understand what that means and power dynamics around that. Thank you.
Yeah, thanks for that, Liesl. And I'm sure there are others on the call who would agree with you. I've got Dr. Shaw, who did have her hand up, but now something in the chat. Dr. Shaw, do you still want to ask a question? Let's see. Or are you okay with
Hi,
there you are.
Could you just read the chat?
Just to read the chat. Okay.
Yeah,
Can I ask everybody then? There's been some brilliant contributions in the chat here. So if people want to read the chat, and there's the question from Dr. R in the chat there. We will be keeping this chat, and if there is anything that needs to get back to people, then I'm sure the team will get back to you. I think this has been a super session. Some amazing contributions, and I think there's an awful lot there for us to look at for future meetings, because it is obviously just wider than access to work, isn't it? There's a lot more going on there. So we're running out of time now, so I do want to just thank the speakers and the audience for coming along. Thank you so much. It has been so interesting. And just to remind people that the call for evidence for the third report is open now, and we'll welcome submissions from any interested parties, and that will close at 5 o'clock on Tuesday, the 30th of November. And you can send those submissions to the Cerebral Palsy APPG email. of the website for more information on that. I'm also accepting some short multimedia, either video or audio type of submissions as well, and to, you know, just obviously being mindful of accessibility. And that report will be published early 2022. So once again, I want to thank everybody. It's been a really, really useful and enjoyable session today, and thanks to the Secretariat and Action on Cerebral Palsy. It's been super. So have a good rest of the day, and yeah, there's a few waves, few smiles, so I think everybody's had a good time. Yeah.
Mary,
Oh, sorry, Richard.
Yeah, I think Dr. Shah wanted her question read out.
Oh, right. Oh, I'm sorry, Dr. Shaw, is that right? Let me see. Okay, I'm going to read this from Dr. Shaw. I'm really sorry there. I'm Dr. Shaw, a senior research fellow in a medical school at university. I have cerebral palsy and started in August, spent 6 weeks battling with trying to access the new systems and structures as there is no disability officer or staff. I'm scrolling up here. I've lost it. Had to negotiate. I've had to negotiate these as well as doing my job. So was working 6 days instead of 3. My pain and fatigue was sky high, but no one had any clue, so I had to plod on. Any advice for this big institution? I don't know if quickly somebody wants to give Dr. Shaw some advice now, or maybe get back to her. Angela, I can see you talking with your mute button on.
I'm happy to get back to Dr. Shah directly if you're tight on time, Mary.
Is that okay with you, Dr. Shaw?
Yeah.
Okay, you can do that, Angela.
Shall I?
Excellent.
I'll just type my email address in the chat here.
Thank you. It's coming up
Okay,
on your screen as well, so I have it. Thank you.
We'll make
Thanks
sure
for
that
that.
the email gets passed along as well to you, Angela.
Excellent. Thanks for that, Doctor. That's yeah, terrible situation to be in. Hopefully we can get some advice for you there. So yeah, thanks everybody again, and that's been a super session and great contributions from everyone. And for the politicians on the call, let's push this along, this issue along with the government. And have a good day, everyone. Okay, bye bye.